So we have bestowed the Woman of the Year award to 30 amazing women. I'm sure you're wondering, what does it take to win this capstone industry recognition? So let's learn a little bit more about the Woman of the Year award.
HBA Woman of the Year is a platform to make a change.
I believe you become a beacon of light and are trusted for your wisdom.
The qualities of the HBA Woman of the Year really start with her vision for her company, for the business results that they need to achieve, as well as for her own career and for those that are following behind her.
It's important to celebrate HBA's Woman of the Year because these are the role models for the industry, both for women and men.
Please welcome Kenneth Fraser, Chairman and CEO, Merck.
Thank you. Thank you. And good afternoon. It's really a privilege to be here to celebrate so many leaders who are advancing the cause of gender parity in healthcare. And let me just say that the world and healthcare need us to accelerate gender parity. Congratulations to all of you. It's also a privilege to work alongside the extraordinary woman you're going to hear from in just a few moments, Dr. Julie Gerberding. Now, I've had the distinct experience of walking with Julie in places like, for example, Davos, where the World Economic Forum meets once a year. And what you have to know about Davos is it's a place where people who think they're great all get together to feel really good about themselves. And you know, among the people who are engaged in that ritual of self-admiration are a bunch of CEOs. And you know, the CEOs, generally speaking, are the most recognizable people or among the most recognizable people, and Mick Jagger isn't there. But I have had the experience of walking around Davos and hearing people say in a quiet little voice, "Who's that guy with Julie Gerberding?"
I love it.
And that's okay with me because being the guy with Julie Gerberding is a real status enhancer. As the CEO of Merck, I've had the opportunity to meet a lot of impressive individuals over the years. Gifted physicians, scientists, visionary thinkers, inspiring leaders. There are very few people who qualify as all of the above and more. Without a doubt, Julie is one of them. Throughout her remarkable career, Julie has repeatedly been on the front lines of healthcare crises that presented new and complex challenges for the medical community. This includes her work as a very young physician in San Francisco at the height of the HIV epidemic, to her exemplary leadership of the U.S. Centers for Disease Control, where she battled more than 40 public health emergencies, such as anthrax and SARS, all the while providing a calming and reassuring voice to the American public. At Merck, Julie plays a leading role in advancing our mission and providing that same comfort to patients and populations around the world. She has been instrumental in making life-saving vaccines more accessible and affordable for people in developing countries. And since taking on the additional role of Chief Patient Officer in 2016, she's enhanced our longstanding efforts to engage with patient organizations and ensure that patients' perspectives are reflected in all of our decisions. On top of all of that, Julie is a tireless champion of women. Everywhere she goes, Julie works to advance the cause of women's leadership and gender parity. I am proud to say that includes Merck, where she is a devoted mentor and advocate for women at every level of our company as the executive sponsor of the Merck's Women's Network. Talk to anyone who's ever had the good fortune to work with Julie, and they can tell you a story about her intelligence, her compassion, her incredible ability to communicate and inspire. I have too many stories to count, and time is running out today, so let me simply say this. At Merck, we have a belief that was first expressed by our modern-day founder who said, "We try never to forget that medicine is for the people." We try to live by those words, but every fiber of her being allows Julie to embody this notion. And because she does, our company and our world are a better place. And now let's take a look at a short video to learn a little bit more about this year's HBA Woman of the Year.
To not know what to do is a terrible thing, but to not do what you know is absolutely tragic.
Julie is a visionary,
authentic,
one of the most inquisitive people that I know,
compassionate,
and a woman of conviction.
Julie Gerberding knew early on that she wanted to be a physician. At age 4, she was the happy recipient of a doctor's kit. From there, a lifelong passion for caring was born. As a young doctor at San Francisco General Hospital, she battled on the front lines, fighting for people with HIV/AIDS.
It was a very challenging time in San Francisco. It was the height of the AIDS epidemic. Her primary responsibility was creating an environment that was both safe, but also one where compassionate and loving care could be provided.
As the first female director of the CDC, Julie redefined the agency, expanding its public health mission.
I've worked side by side with Julie during some of the toughest times. We dealt with global pandemics like the avian flu. We dealt with post-9/11 threats of biological warfare. We dealt with the anthrax attack and alarm over smallpox.
I mean, we were going at 100 miles an hour all the time. Where Julie was really visionary was understanding if we could do something about HIV in Africa, the impact on public health would just be tremendous.
Julie sees the world as a very interconnected place. The challenges that you might face in a small community in Africa can have connectivity with the challenges you'd face in the inner cities.
Julie is currently Chief Patient Officer and Executive Vice President for Merck.
To make sure that the great innovations that Merck developed could be available to everyone who needed them. In many instances, she played a key role in writing the playbook for how you do that work.
Throughout her career, Julie has been a visible and influential role model for women.
She's a great mentor to me. She practices what I call straight talk, and she's asked us as women at Merck to speak up and lean in, which is often difficult, but when we see leaders like Dr. G doing it, it becomes something that we see possible and we want to do.
Julie is respected across the globe as a scientist, as a public servant, as a businesswoman, and as a genuinely good human being.
One person alone can do something, but one group together can change the world.
Please welcome the 2018 Woman of the Year, Dr. Julie Gerberding, Executive Vice President and Chief Patient Officer, Merck.
They're taking.
Well, that was pretty awesome. And the video was definitely a surprise. So thanks, team. It was wonderful. Ken, as a brilliant colleague and an amazing leader, you really exemplify all the ideas and ideals that I plan to discuss today and are, I think, a terrific role model for all of us. Thank you, David Rose, my dear, dear husband, and my wonderful friends, Gina Puglisi, Denise Cardo, Mike Osterholm, Nancy Turret, and Jim Down, who have shared so many chapters in my life and worked hard to be with me here today. And of course, I appreciate that Roger and Miriam from the Executive Committee and all my Merck colleagues are here, taking a lot of time out of a busy period in Merck's life to join this special occasion. I certainly also thank the Healthcare Businesswomen's Association. I've long admired the advancement of women in healthcare that HBA advocates for, so this award is especially meaningful. And heartfelt thanks to the former WOTY awardees and leaders who shared their wise counsel and their encouragement with me last evening for dinner. I also thank Nick Colucci, Terry Pasquarelli, and all the luminaries and rising stars around the room, especially Merck's own rising star, Kunbi Rudnick, for their awesome leadership that's being recognized this afternoon. You know, I'm often asked if I had any women physicians as role models when I was a kid. And I grew up at a time when it was pretty rare to find a woman physician. But I was fortunate to live in a community where a full 50% of the doctors were women. Of course, I should probably mention that my childhood home of Esteline, South Dakota had only 822 people, and we only had 2 doctors, 1 man and 1 woman, and they were married to each other. Even so, it was an early example of the kind of gender parity we should be striving to achieve. I'll always remember that it was Mrs. Dr. Marr who showed me that a career in medicine was possible even for a little girl like me. So I'm also grateful to my parents who raised me with a strong and very disciplined work ethic. Even though they were often financially challenged, they gave me the best possible education we could afford and emphasized that if I was willing to work hard enough, any dream was possible, even medical school. And I'd be remiss if I didn't mention that my mom is now in her 80s, and she's still teaching theater history as an adjunct professor at the University of Sioux Falls, so pretty incredible role model for me. Thank you. So I've had the privilege of working in a lot of different arenas, at the bedside, in academia, in government, and now in the private sector. And a lot of people ask me how I've navigated all these complex transitions, but I didn't really experience them as big jumps, because at my heart, I am a physician, and this is core to all my roles. It's really just been a question of aperture. How wide do I open my aperture at any given point in time? So I started by treating patients at the bedside in individual hospital settings. Then, when I opened my view a bit, I focused on improving the health of populations of patients and healthcare workers in San Francisco. A still wider view brought me to national and international public health policy at CDC. Then Merck's Vaccines business brought the prospect of disease prevention across people's entire lifespan into view. And now my newest team at Merck is focused on achieving sustainable global health impact in the context of things like assuring affordable access to medicines, advocating policies that help sustain our ability to invent new medicines and vaccines, improving maternal mortality, and my dream, catalyzing HPV cancer elimination. So for me, my career changes have really been a matter of scale and breadth, not really one of content transformation. But kind of in keeping with the Moroccan proverb you just heard about, I really don't want to spend my time with you today reflecting on the details of my career path. I'd rather share some of the most important principles that have served as my consistent guideposts along the way. I think of them as the 3 V's. First, learning is vital. Second, every life is valuable. And finally, true leadership is valiant. So I'm going to dive into these just a bit and explain how they might relate to our collective leadership as women in the healthcare industry who are tackling the complex challenges that we face today. So let me start with the first V, that learning is vital. You know, I'm an infectious disease doctor, and I spent a lot of time in the research lab, so I learned to think like a bacteria. And how do bacteria grow? Well, they divide and they double. So 1 becomes 2, then 4, then 8, then 16, then 32, and so on. In this rapid phase of log growth, they just frolic around and enjoy themselves doing whatever it is the bacteria do until they run out of nutrition, or if they're in the lab, until their beaker gets too small. And when that happens, they go into a stationary phase. Growth stops. And of course, if you don't do anything, they'll die. So if you want to keep bacteria alive and happy, you either have to freshen the media or you have to move them to a bigger home and provide a more nourishing environment so that they can go back into log phase and keep growing. And that's pretty much how I've tried to approach my professional career, making decisions to assure that I stay in log phase. I was really lucky early in my career to have a tenured faculty position at the University of California in San Francisco. And you know, I loved my patients. I had a new lab, great grant support, wonderful fellows, pretty much everything you're supposed to have in academia to be successful. So when they asked me to join the CDC in 1998, there wasn't really anything pulling me in that direction. But then I thought, you know, I do need to keep learning and growing, and maybe it is time for me to learn something new and get into a bit bigger beaker. Well, a few years later, I had the honor of being appointed as CDC Director, and believe me, I entered into an incredibly intense log phase of learning and growth. I went from leading a small division of about 80 people to responsibility for a global agency with a multi-billion-dollar budget, more than 10,000 employees, and accountability for a series of really unprecedented global public health challenges. It was a huge and scary step, but it was also an incredible opportunity to evolve professionally and to help make a difference on a much bigger scale. I pretty much had the same feeling when I joined Merck. I accepted my first role as head of vaccines without any background in finance or vaccine manufacturing, and we faced a lot of really tough business challenges. But since then, it's been a privilege to learn a completely different side of our industry at Merck, in a really big beaker that is full of colleagues who have passion and a true humanitarian spirit, who conduct great science, invent amazing medicines and vaccines, and achieve global health impact. And by the way, I'm definitely still learning from them, and I don't plan on stopping anytime soon. So I believe that everyone can benefit from thinking like a bacterium and seizing opportunities to learn and grow. But more importantly, the health challenges we in this room are managing don't really have easy solutions, and for us, learning isn't a luxury. Learning is truly vital if we are to have an impact on the lives of the people we serve. So that brings me to the second V principle I want to discuss, which is that every life is valuable. I learned this core concept first from my grandmother. Graham was the formidable matriarch in our family and quite a character. She had a huge impact on all of us, and one thing about her was that she always had an open door policy. For example, when we sat down at Thanksgiving dinner, we'd usually be sharing it with some people we'd never seen before. Lost souls that she'd encountered somewhere around town, like the laundromat, who didn't have a place to spend the holiday. And she would tell us, life is about sharing with people who aren't so lucky. Their lives matter just as much as ours. I'm sure we all agree with my Graham in principle, but when we look around the world, or even our own neighborhoods, we can't help but see the glaring disparities that impoverish the lives and spirits of too many children and their families. Probably the most poignant conversation I had on this topic occurred several years ago at a town hall meeting in Ethiopia when I asked each person to kind of describe how they came to CDC. A shy young Ethiopian man in the back of the room raised his hand and said this: "My job as a boy was to tend our sheep. It gave me a lot of time to think. And one afternoon, as I was resting in the pasture and the sheep were grazing, I noticed a jet flying above me. And I began to wonder, why is it that some people can travel the world in such luxury, but I have no hope of ever leaving the ground? What kind of world is it where a few people have so much opportunity and many people have so little? Isn't each life on this earth worth the same, even in Ethiopia?" Well, fortunately, that budding philosopher excelled at school and was able to travel to Addis on a college scholarship to get a great job, and I wouldn't be surprised if he's now an Ethiopian Air frequent flyer. But for me, his simple musings connect my grandmother's philosophy to my professional life. Every human life has value, no matter where that life is located or how hard we have to work to positively influence it. That's as true for the shepherd in Ethiopia as it is for the expectant mother in New York City, where African American women are 12 times more likely than white women to die during pregnancy and childbirth. Unconscionable tragedies like this must end, and we all must play a part. In that spirit, I really want to take this opportunity to publicly thank the Merck for Mothers team who is here today for their leadership and innovation. Thank you. Thank you, Naveen and Marianne and everyone. As we tackle big healthcare challenges like this, we can't ever lose sight of the individual people whose lives truly depend on our work. We have to champion their cause and fight for equitable access to the benefits that good health and well-being can provide. So the final V principle I want to share is one that I think everyone here has experienced, and that is valiant leadership. Now, I'm not talking about the kind of bold courage that we ascribe to the superhero leaders in our society, those amazing, unusually attractive, and usually male, fearless creatures that somehow seem to exist on a plane above the rest of us. I'm talking about everyday leadership courage, the kind of courage that shows you to show up, speak up, and stand up, or as Nick said, act up for something or someone. And when I think of this kind of valiant leadership, the first person who comes to mind is one of my early mentors, a wonderful professor at UCSF named Connie Wofsy. In the early days of HIV, when many doctors were afraid to treat patients, Connie opened the first dedicated AIDS ward in the world. And while most people were focused on the risks among gay men, Connie saw that many women, including those in the sex industry, were also vulnerable to AIDS. She had compassion for every patient and the courage to publicly advocate for them. So her valiant leadership took her to the boardrooms of Fortune 500 companies to combat discrimination against people with HIV, and into television network studios here in New York to demonstrate how to use a condom, much to the dismay of her teenage kids. Connie died of breast cancer in 1996, and I've never forgotten our conversation shortly before that when she sat me down and said, "Julie, I may have a life-shortening illness, but I certainly don't have a life-threatening illness, and I still have vital work to finish. Part of that work is passing my baton on to you." Of course, that was a profound and poignant moment for me, and I promised her that I would try and carry forward her valiant leadership and be a visible advocate for the people who need our medicines and vaccines the most. One of the things I've learned along the way is that because leaders are not endowed with superpowers, they need to find ways to leverage the collective powers of people with diverse skills and knowledge that complement their own. I certainly learned that at CDC when the White House charged us with critical aspects of global pandemic preparedness planning. That meant we were responsible not just for global outbreak response, but for doing things like grounding airliners and quarantine passengers at the 28 largest United States airports. Needless to say, I didn't exactly learn that in medical school. That kind of complex logistical planning wasn't one of CDC's core strengths. So as a leader, it left me only a couple of choices. We could try to figure it out and likely fail, or we could get help from the people with the expertise that we needed. And we thought about who that would be. We realized there's really only one institution with that kind of operational capability, the US Army. Well, I couldn't bring the Army to Atlanta, but we did the next best thing. We hired a 3-star general and a whole cadre of colonels and their teams to come in and help us learn. Now, public health and the Army have radically different cultures. So bringing in guys with a nickname like Chainsaw to work alongside a bunch of people most comfortable in Birkenstocks was a bit of a risk. But because we took that valiant risk, we evolved a state of advanced preparedness through full-scale functional exercises involving hundreds of people in multiple geographies and multiple sectors around the world. And we really did bring down a jet airliner with mock passengers in Miami International Airport. You don't have to ground a commercial flight to be a valiant leader, but I think the example is relevant because everyone here can find themselves in the comparable situation. We're working to solve really hard, really complex, wicked health challenges. And the simple truth is that no one can do this alone, no leader and no organization. It requires coordinated contributions across different disciplines, sectors, and cultures. It requires a network of people who bring a diverse range of experiences and perspectives to the table to achieve the goal, and we have to play to their collective strengths. Most of all, it requires valiant leaders who are equipped to manage this kind of horizontal network, which is very different than managing a vertical hierarchy. Horizontal leadership requires collaboration and negotiation. It requires emotional intelligence and shared values, more learning and less knowing. It requires recognizing that a winner-take-all outcome may not be the winning outcome. Collectively, these attributes are pretty hard to find in any one leader. But in my experience, when I do find such a leader, more often than not, that leader is a woman. And that is why it's so critical that we have more women around the table when important decisions about the toughest problems are being made. When I started my initial job at the CDC, I showed up at my first division directors meeting and found a table with 2 rows of chairs around it. The second row was full of women. They were the subordinates and the assistants. I was the only woman in the first row with the more senior male leaders. And when I sat down, all the other women in the room spontaneously started clapping. It seemed like a small thing, but the simple act of taking my seat at the decision table sent a powerful signal. In that moment, I felt hope that things really could change. I also realized that women actively encouraging and supporting other women is an incredibly powerful accelerant for that change. So, as I accept this wonderful award, and I am truly humbled and honored, I also have a request. Please keep learning. Stay in log phase in the biggest beaker you can imagine. Keep the value of all the lives you affect in your hearts and approach your work with urgency. And above all, please keep valiantly leading and clap loudly for those coming behind you. We don't have to be superwomen, but if we keep the 3 V's in mind, we can become a united force for change. And together, we will create a better, healthier future for all. Thank you. Thank you.